I'm a cancer survivor.
I am a cancer survivor.
I am a cancer survivor. And I'm a cancer survivor.
You have just been diagnosed with cancer. What are your options?
As I go back to the doctor year after year to be examined in a cystoscopy, and I have to tell you that the label that I now carry is that I am totally cancer-free. In fact, the doctor said out of remission and cancer-free just as of January of this year.
That's where I come in. My name is Dr. James Forsyth. I'm a medical oncologist, board certified. I did my training at the University of California in San Francisco, my fellowship. Prior to that, I was a trained pathologist. Later on in my career, after I moved to Reno some 30 years ago, being the first oncologist in the Reno area and starting the cancer wards at all three major hospitals, as well as running the VA cancer program and being an associate professor of medical oncology at the University of Nevada Medical School, I became aware of the advantages of using alternative therapies in cancer patients. I saw cancer patients who were coming to me from naturopaths and homeopaths, and they were doing well. This did not fit into the paradigm that I had learned in medical school and internship, residency, and my fellowship, where basically patients were treated with surgery, radiation, or chemotherapy, and that was it. There were no other options. And when patients come to me and they say, I've just been diagnosed with cancer, they come to me oftentimes very, very anxious, depressed, wanting answers, already perhaps being told by their surgeon that they need to go right under the knife, that they need to have radical surgery. Many times all the side effects and dangers of the surgery, the anesthesia, the infections involved, and the morbidity that they come away with after surgery are not fully explained to them. Similarly with radiation, they are told about radiation, but they're never told about the radiation brain injuries, the radiation injuries to their lungs, to their liver, their kidneys, their bowels, and even to the pelvic organs. So they need an objective opinion from a doctor who does not have a dog in the fight, so to speak, someone who is objective and someone who can give them straight answers.
Hi, my name is Doug Ray, and I'm a cancer survivor. I was diagnosed with multiple myeloma, stage 3, on May 1st of 2006. And it was confirmed by an IgG tumor burden load of 7,500 and an MRI which said I had lesions on my ribs and my arms, and I had 3 compression fractures. I was told on May 1st that it was a serious situation and I couldn't even leave the hospital, so I was admitted immediately. And I was told the standard of care was going to be 5 rounds or about 5 months of chemotherapy, and then it would be followed by a autologous bone marrow transplant. So I began the chemo treatment every 4 days on a continuous basis. As soon as I was released from the hospital, I went home, and I had heard about the PolyMVA product at a previous meeting I'd gone to with the Cancer Control Society. I got in touch with the people that provide the product, and on May 15th of 2006, I started using the product. My experience after that was doing both simultaneously. My IgG had skyrocketed to 7,500 as a top, and by the end of the first month of treatment, I was down to approximately 2,000, which was a very, very good sign of my recovery. I continued the chemo on a lighter basis for June and July because I experienced neuropathy in my foot, meaning numbness. And so they cut the chemo in half at that time. Then I upped my dose of PolyMVA to 16 teaspoons a day for the month of July. By the end of July, I was back to normal on my blood readings, so I chose to stop doing the chemo treatment. So I'd had 90 days of chemo treatment. I continued to do poly-MVA. I also declined to do the bone marrow transplant after interviewing several other patients who had had it done and expressed the concern for what happened to them. I then just continued on the poly-MVA. In November of '06, on the 14th, I was declared by my oncologist to be in complete remission, and that was my status as of then. I started to do less and less of the poly, and I went for about 6 or 7 months on low-dose poly-MVA. Then I had one experience of stress in June of this year, of 2007, and my numbers started to go up again. So I increased my dosage of the poly-MVA back up to 16 per day, and I continued that protocol until now. And I would comment as far as my quality of life standard right now is borderline between excellent and outrageous.
Hi, my name is Dr. Bill Crawford. I live in North Carolina, and I've been involved with the poly-MVA company and the product for, well, since its inception over 12 years ago. I was the first doctor in America to use poly-MVA, and the results that I have seen have just been absolutely astonishing. Even the patients who come to our clinic that are stage 4 with widespread metastasis and really very critically ill have pulled through and have been pronounced cured and living a very healthy lifestyle at this point in time. And we're talking about brain cancer, prostate cancer, bladder cancer, breast cancer, the whole 9 yards when it comes to cancer. So I think poly-MVA initially began being utilized as a cancer therapy for brain patients primarily because it crosses the blood-brain barrier very freely. But at the clinic in Toronto where the research was being done, they noticed that all the cancer patients were responding. And so therefore, the product that we have today, the poly-MVA, is used for a myriad of cancers. It can be a hormonally related cancer or otherwise. It's helpful, and we have seen it in my practice for many years now, helpful in every cancer that we've used it on.